Management of Bone Fractures in the Older Adult. Prevention, Management, and Healing by Lisa Bryans, Abigail Mello, and Sarah Olin. Many patients experience post-fracture immobility, weakness, depression, subsequent fractures, and decreased quality of life, with up to 37% dying within the first year and 50% unable to live independently. The best way to decrease the risk of fracture is prevention. Improving bone mass, strength and balance training, medications and dietary supplements, and prevention of falls by monitoring extrinsic and intrinsic factors. Extrinsic factors can have a big impact in fall reduction. Assessing the patient's living environment for loose rugs, even flooring with no water spills, ensuring the area is well lit, removing clutter including electrical cords. The patient should have non-slip footwear and recent eyewear assessment. Intrinsic factors to assess for including cognitive impairment, gait and balance disorders, including assess the need for an assisted device around the house if needed, sensory impairment, postural hypertension, history of falls, and a medication assessment. Because they can cause the patient to fall if a patient is being prescribed an unneeded medicine. Assessing for osteoporosis is your physician's first step, and then deciding and managing the patient's osteoporosis by medications as needed. But the most effective factor in prevention of fracture is strength training and balance training. This has been shown to be the most effective in the prevention of falls and fracture. If a fall or fracture does occur, your treatment plan needs to focus on these 5 factors for optimal healing and improved quality of life: improving bone density, muscle strength, balance and mobility, and assessing and treating for depression and pain. After a fracture, the physician can prescribe medications or supplements according to the patient's plan, and strength and balance training during healing will be key. It's important to do strength and balance training, as stated, for a majority of function recovery occurs within the first 6 months, because inactivity leads to disability. An increase in disability can lead to depression. If a patient's not able to do the things they enjoy, they are at increased risk for depression, and an education is needed for this patient on social support. Interaction during exercise sessions can improve the healing process. Pain management can also play a big role after a fracture. Assessing a patient for pain and treating and managing that adequately during the healing and rehabilitation process can improve a patient outcome after fracture. Unfortunately, risk of hip fracture only increases with age. It's crucial to first focus on prevention to improve one's strength and balance to decrease the risk of fracture.